Bismillahirrahmanirrahim. So I will start with the quote of the day, which is from Quran. Kullu nafsin zaikatul maut. Every soul will taste death. I am Dr. Taimia Ayub, and today I will be presenting the topic My Years of Mortality under the kind supervision of my supervisor and Professor Dr. Saira Afzal. So we will start with the outline of this presentation. We will first have introduction to the concept of mortality, importance of measuring mortality in public health, absolute numbers versus rates, what are the different types of mortality measure, rate, ratio, proportion, and then we will discuss their further types and things like maternal mortality ratio, proportionate mortality, and concept of years of potential life lost. And why do we need to measure mortality and how is mortality recorded and how are the deaths counted? And it will be followed by MCQs at the end. So the objectives of today's presentation are to define the concept of mortality, differentiate between various mortality indicators, understand how mortality is measured, discuss global and national targets, especially SDGs, identify key causes of mortality, and at the end, what is ICD system for reporting causes of death. So now we will start with the basic concept of what is mortality. Mortality refers to the state of being subject to death. In public health and medical context, it specifically relates to the incidence of death in a population. So, why do we need to measure mortality and what is the reasoning behind measuring mortality? Death is the ultimate experience that every human being is destined to have. Similarly, it is considered the ultimate worst outcome for a particular disease or a condition. It is an important indicator of population health. It helps in identifying health priorities. It also helps in monitoring disease trends over time. It has very important role in policy and then planning, and it is important in the evaluation of health systems. So, when we are measuring mortality or even when we are measuring morbidity, there are three types of mathematical ways which we usually calculate it by. First is known as rate, second is ratio, and then there is proportion. So, what is rate? It measures the occurrence of some event in population during a given time period. So, the most important thing to be remembered about rate is that there is involvement of time, always. So, it has basically four components. One is the numerator, the denominator, time specification, and a multiplier. Multiplier is the usually the number 100 or 1000 or 10,000, and it depends upon how big is the specific calculation we want to do. So it varies from different formulas or different types. Then we come to the ratio. A ratio is a comparison of two separate quantities. We have done the concept of ratios in our maths in school also. So it is the same ratio, but with a public health perspective. The most important point, if you want to remember about the ratio, is that numerator is not part of denominator. So they are two different entities which we put into the same equation. Then we come to the proportion. A proportion is a type of ratio in which numerator is part of the denominator. It tells you what fraction of the total has a particular characteristics. All these three types now will be explained further. But first, I want you to have a look at this graph. On the right side, we have a graph. If you can see, we have here on the bottom of the right side, starting from 1969 till 2013. On the left side of the graph, we have 200,000 till 600,000, which are the number of deaths. And the graph is giving us the trend in the absolute number of deaths by cancer for both men and women in United States. So as you can see that the absolute number are increasing. It started from 1969 and then till 2013, it is somewhere between 500,000 and 600,000. So we can understand from this is that the number of cancer patients is increasing in United States in the past few decades. But from this graph, we cannot say that the risk of dying from cancer is increasing. Because what if the population is also increasing at the same rate as the number of deaths by cancer? So if they are both increasing at the same rate, then the risk of dying from cancer remains nearly the same. So what we get from this graph is that the absolute number do not tell us about the risk of dying from a particular cause. They give us an indication, but if we don't know the total population or the time period, we cannot say much. So let's continue. So now we come to the rate of cancer death rates for male in United States from nearly the same but a bit different time period, 1930 to 2014. So you can see clearly that the rate of cancer, for example, if we look at this blue line particularly, it increases in the 1990s and then it start decreasing. So the cancer deaths in form of rate, they are decreasing. So if we wish to address the risk of dying, we must deal with rates. So rates give us are a very important indicator when we want to get an idea about the risk of dying from a particular disease, for example, cancer in this. So this is something I wanted to stress upon. So now we come to the first kind of mortality measurements, which is mortality rate. It is further divided into three broad types, which is annual death rate, or also known as crude death rate. Second is age-specific mortality rate, and third is cause-specific mortality rate. So what is annual death rate or crude death rate? We all have some concept about it, so let's just go through it and see with examples. The crude death rate is the number of deaths from all causes in a given population during a year. So as you can see in this equation, annual mortality rate for all causes is equal to total number of deaths from all causes in 1 year divided by number of persons in the population at mid-year into 100,000. So what I told you about the rate in the previous slide was that it should have four components: a numerator, a denominator, a multiplier, which is 100,000 in this case, and time specification. And you can see both the numerator and denominator have time specification of 1 year and mid-year. So it is called crude death rate because it does not account for age, sex, or other such factors. Note that because the population changes over time, the number of persons in the population at mid-year is generally used as an approximation of average population. Anyone in the group represented by the denominator must have the potential to enter the group represented by the numerator. So anybody in the denominator group should have the chance or the capacity to go into the numerator group depending upon the circumstances. So this is a figure of the world map, which is showing us crude death rate in the year 2023. So in the below, you can see that it is telling us how different shades are telling us the percentage or the crude death rate. So 0 to 5 is represented by very light yellowish orange color. 5 to 10 is slightly darker color, 10 to 15, and then I think only one country has greater than 20 death rate. So if you can see that the world death rate in 2024 was 7.76 per thousand people, and Pakistan's crude death rate was about 7.021 per thousand people, which is nearly the same as the crude death rate, and Pakistan is also represented by the orange shade you can see here. So now we come to another important term, which is the age-specific mortality rate. It is the number of deaths in a specific age group per thousand or 100,000, this is the multiplier, people in that same age group in a given time period, usually 1 year. So age-specific mortality rate has the formula of number of deaths in a specific age group divided by mid-year population of that age group multiplied by 1,000 or 100,000, which is the multiplier. So you can see it is the same uh, factors which are present, but still there are a little bit of changes to account for the age specification. In putting a restriction on age, for example, the same restriction must apply to both the numerator and the denominator, so that every person in the denominator group will be at risk of entering the numerator group, as we have explained previously also. When such a restriction is placed on a rate, it is called specific rate, or in this case, age-specific mortality rate. So these are some of the common examples of age-specific mortality rate. First of all, we come to neonatal mortality rate. Deaths of infant within the first 28 days of life per 1,000 live births. It indicates quality of prenatal, delivery, and immediate newborn care. Pakistan has neonatal mortality rate of 42 deaths per 1,000 live births. Then there is the very famous infant mortality rate, which is the number of deaths of infants under 1 year of age per 1,000 live births. It reflects healthcare access and also maternal and infant health. Pakistan has infant mortality rate of 62 per 1,000 live births. Then we have the under 5 mortality rate. It is the number of deaths of children under 5 per 1,000 live births. It assesses child health and survival. Pakistan has under 5 mortality rate of 74 per 1,000 live births. So it is very important to understand that neonatal mortality rate and then infant mortality rate all comes together and they're added in the under 5 mortality rate. Also, you can see on the right side that I have put two icons of this is the SG3 goal of good health and well-being in front of neonatal mortality rate and under 5 mortality rate. I will explain this further in the next slide. So for the SDG target 3.2 and its indicator, we particularly focus on the neonatal and under 5 mortality rate. So the target is by 2030 to end preventable deaths of newborn and children under 5 years of age. So the target 3.21 is under 5 mortality rate to be at least as low as 25 per 1,000 live births. And the other 3.22 is a neonatal mortality rate to be at least as low as 12 per 1,000 live births. So as you can see, Pakistan is very far away from the targets. So this is a very interesting slide. You can see that it is telling us child mortality rate, which is specifically here is under 5 mortality rate. And the picture showing right now is that of 1950s. So that is the earliest available data for most of the countries. And you can see that the color is very dark red for all of the world nearly, apart from the North America and Australia. So the dark red is indicating here that the mortality is between 20% to 50%. And now we will see, you can focus on Pakistan right now in this, and then we will see how it is changing. So from 1950 to we will go to 2023. Let's start. I hope you can see now that only Pakistan and Afghanistan are the country in 2023 to have the same under 5 mortality rate, which is comparable to the African countries, which is very sad because we are very better than other African countries in other indicators. But for particularly child mortality, we are doing not very great as compared to our region. So we are in very much there is chance that Pakistan is not going to meet its target of SDG 3.2, which I have explained previously. Let's go to the next slide. Now we come to the disease specific mortality or the cause specific mortality rate. It will be the formula is nearly the same. Let's explain. The disease specific mortality rate is the number of deaths due to a specific disease or a specific cause per 100,000 per people in a population during a given time period. So the cause specific mortality rate is deaths from a specific cause divided by total population into 100,000. So the most specific example of this cause specific mortality rate is maternal mortality rate. It is the frequency of maternal deaths in relation to the total population of women of reproductive age. Usually it is calculated as 15 to 49 years of age in a specific time period, often a year. So the maternal mortality rate is number of maternal deaths divided by number of women aged 15 to 49 years into 100,000. So as you can see that the denominator in this case is the number of women in the reproductive age. So these are the women who have the potential to go into the numerator. So I wanted to stress on the denominator in maternal mortality rate, and then we will discuss it further in the next slide. So now we have a very important concept of case fatality rate. Case fatality rate is a measure used to assess the severity of a particular disease. It represents the proportion of individuals diagnosed with a particular disease who die from that disease over a specified time period. It is the number of deaths due to a particular disease divided by number of diagnosed cases of that disease multiplied by 100. For example, if 100 people are diagnosed with breast cancer and 5 of them died due to breast cancer. So this is how we will calculate the case fatality rate. 5 divided by 100 multiplied by 100 is equal to 5%. So this is the case fatality rate. Case fatality rate is a measure of the severity of the disease. It tells us how severe a particular disease is, that those who are diagnosed with the disease are going to die. It can also be used to measure any benefits of a new therapy if we are looking into that. Okay, this particular slide is going to explain the difference between mortality rate and case fatality rate again, because they get a bit confusing. So on the left side, you can see there is a big square. These are total of 100 squares in it. Okay, so 80 of the squares are healthy, which are represented by blue squares, and 20 of the squares are infected above, or out of infected, one is diseased. So these are the 19, one is diseased, and 80 are healthy. And in total, these are 100 squares. Same is the case here. It is the exact same square, but we are going to do the calculation here differently. So for mortality rate, one who is diseased is divided by total of 100 people, and the mortality rate comes out to be 1%. For case fatality rate, we take one diseased person, divided it by the total 20 person who got infected. So case fatality rate here is 5%. So here you can see that we have the same population, but how we are calculating or how we are looking at the different mortality rate versus case fatality rate is the difference. So in mortality rate, the denominator represents the entire population at risk of dying from the disease, including both those who have the disease and those who do not have the disease, but who are at risk of developing the disease. In comparison or in contrast to this, in case fatality rate, however, the denominator is limited to only those who already have the disease. So now we come to another common concept, which is related to the proportion of mortality, and it is called proportionate mortality. Proportionate mortality refers to the proportion of all deaths that are attributed to a specific cause within a defined population and time period. It tells us how significant a particular cause of death is relative to all deaths, rather than how common the disease is in the population. So the formula for the proportionate mortality is deaths due to a specific cause divided by total deaths from all causes multiplied by 100. So it usually is given in a percentage. Example of proportionate mortality will be explained. So imagine a city. Over the course of 1 year, there were 5,000 total deaths from all causes. Among these deaths, 1,200 people died due to heart disease. The rest died to different other causes, for example, cancer, accident, infections, etc. So proportional mortality from heart disease is calculated is deaths due to specific cause divided by total deaths from all causes multiplied by 100. So we divide 1,200 divided by 5,000, multiply it by 100. So we have 24%. So out of all the deaths, 24% of the deaths were attributed to heart disease. And now we come to a very important concept, which we are going to hear again and again in our daily lives also, which is the maternal mortality ratio. It is a concept of ratio. So if you remember, what we said in the ratio is that it is the numerator and the denominator are different than each other. So let's explain it. It measures the number of maternal deaths per 100,000 live births during a given time period, usually 1 year. It reflects the risk of a woman dying due to pregnancy-related causes per live birth. So, maternal mortality ratio is number of maternal deaths divided by number of live births multiplied by 100,000. And in this, for this particular disease, maternal death is defined as the death of a woman while pregnant or within 42 days of termination of pregnancy from causes related to or aggravated by the pregnancy or its management, excluding accidental or incidental causes. So why maternal mortality is important? That it is also a very important indicator and target which has been mentioned in the SDGs. So this is taken from the WHO site, which says that Sustainable Development Goal Target 3.1 calls for a reduction in the global maternal mortality ratio to less than 70 per 100,000 live births by 2030, and no country should have MMR greater than 140 per 100,000. And where is Pakistan standing right now? This is from a Gallup Pakistan survey, which tells us the maternal mortality ratio of 2020. And it, according to this, Pakistan is at 154 per 100,000 live births, which is very large as compared even to the Asian maternal mortality ratio, which is 99. So much work is needed to be done here also. So now we come to another concept, which is slightly new, which is year of potential life lost. In recent years, another mortality index, years of potential life lost, has been increasingly used for setting health priorities. YPLL is a measure of premature mortality or early death. For example, an infant dying at the age of 1 year has lost 74 years of life. 75 is taken as an arbitrary value. And then we calculate it by 75 minus 1. But if a person dies at 50 years of age, he has only lost 25 years of the potential life he was supposed to have. Thus, the younger the age at which death occurs, the more year of potential life are lost. So this is from the CDC website, which tells us that the unintentional injury contributed to the more year of potential life loss than any other cause of death in 2023. So 3.5 million people died due to unintentional injury, which included poisoning, motor vehicle traffic, other injuries, suffocation, drowning, falls, and then cancer, heart disease, and suicide. So the younger the population is, the more we are going to lose the years of potential life lost. So now, how death is reported, or how deaths or mortality is counted. So this is taken from Goddess Epidemiology, and it shows us that in early 1900s, when the process of death certification was not very streamlined, these are some of the actual causes which were seen from the death certificate. For example, died suddenly without the aid of a physician. A mother died in infancy. Deceased had never been fatally sick. Died suddenly, nothing serious. Went to bed feeling well, but woke up dead. So you can see it is supposed to be a little uh, confusing that these causes are not telling us at all about how the person dies and what were the underlying causes. So this is something they took out from the death certificates, and you can see that the process is very much streamlined now in the developing countries. So counting and reporting of deaths. Deaths are counted systematically through official records and surveillance system. These counts are vital for health planning, disease monitoring, and policy making. So these include vital registration system, for example, official civil registration, vital statistics, which record births, deaths, and causes of deaths, hospital and health facilities, and then household service and censuses. So every medically attended death should be documented with a death certificate that includes the name, age, sex, date and place of death, causes of death, which include immediate, underlying, and contributing causes. So how do we label those causes? In here, ICD-11 comes. ICD stands for International Classification of Diseases, and 11th it is revision session, the global center standard for diagnostic health information. It is a standardized system developed by the WHO for coding diseases and causes of death. And ICD-11 is its latest update. So now we are going to discuss few recent updates. This is taken from the Lancet website, which tells us about the global burden of the disease. We all have heard about the GBD. It includes about the 204 countries and territories, 371 diseases and injuries, 88 risk factor, and the latest issue has come on 18th May 2024. It offers a powerful resource to understand the changing health challenges facing people across the world in the 21st century. So, the global burden of 288 causes of death and life expectancy decomposition in 204 countries, it tells us that the analysis used 56,000 data sources, including data from vital registration and verbal autopsy, as well as surveys, census, surveillance system, and cancer registries, among others. As with previous GBD rounds, cause specific death rate for most causes were estimated using the cause of death ensemble model, a modeling tool developed for GBD to assess the out of sample predictive validity of different statistical models. So, this is a particular model developed by the GBD for calculating the cause specific death rate. And this shows, this is from the World Health Organization Global Health Observatory website. It tells us the top 10 global causes of deaths in 2021. The number one is ischemic heart disease, followed by COVID-19, and then stroke. And in these down to tuberculosis at the end. And then it shows the top 10 causes of deaths in Pakistan in 2021. It has the same as the world. It has ischemic heart disease at the very top, followed by COVID-19. Then it has preterm birth complications. And at the end, we have congenital anomalies. And now we come to the multiple choice questions. So we will start with the first question. Why are mortality rates preferred over absolute number of deaths in public health analysis? Option A are rates are easier to calculate. Option B, absolute numbers are outdated. C, rates account for population size and risk. D, absolute numbers cannot be measured. Or E,